As soon as, you know, the word cancer, you think, you know, how long have I got? You know, it's just doomed. But obviously, as you go on, cancer's not a death sentence. It's, you know, what they're doing now is absolutely incredible. Well, the first time I thought something was wrong, and early in the morning I started coughing up a bit of blood. And it wasn't a lot of blood, just like a trace. And it wasn't in the afternoon, it was the first thing. As soon as you wake up in the morning and you're a bit chesty, a bit phlegmy, and then you cough, and then you spit into a tissue, and then you think, But as a typical man, I ignored that for a few months, which is bad. And it wasn't until my wife saw it and says, that's not good. She's going to phone the doctors. And that's when it all started, really.
My name is Marco Nardini. I'm one of the chest surgeons here at Leeds Teaching Hospital. Usually when a patient comes to see a surgeon, it's good news because the cancer can be removed and he has the best chance of treatment.
Could be at work on the computer, working away, and you feel like you're just falling asleep, you know, and everything was a chore.
Thoracic surgeon activity is mainly lung cancer surgery, and we play an important role in delivering treatment for patients with lung cancer. I met Rob and his family in clinic when we discussed the finding of the CT scans and the possible treatment option, focusing, of course, on surgery. Lungs have some natural division. The right lung has got two natural divisions, dividing the lung into three lobes, three parts, and the left lung has got one division, dividing the left lung into two parts. And in the past, we used to offer a lobectomy, such as to remove a lobe in order to remove the cancer. But in most recent year, we have studied that in early stage lung cancer with tumor of 1 or maximum 2 centimeter diameter, we can remove less than the lobe, offering the same long-term outcome in terms of cancer treatment and risk of recurrence.
So the thing going through my mind while I was waiting for treatment was, how long have I got? And it's just, because I mean, I love life so much, and you think, is that going to stop? And it's, you know, it's scary, very, very scary. When you come into Leeds Hospital, you know, you have to be here for 7 in the morning, and you walk in and it's just a corridor of people. And you think, oof, you know, this is real, this is happening. And it was quite funny really, because they were calling the names out. And Janet was my wife, and she were all upset and in tears, and I thought it was Janet going in, and I said to the nurse, no, it's me. So I think it's worse for the, you know, for your other half. You know, you got to think of them as well. It's tough. And I was having a biopsy, and obviously I knew something was wrong, but I had to have a biopsy, like threw me back into my lung. And into the tumour to see how bad it was. When I first got told I had to have surgery, it's like relief in one way, thinking, right, we're going to get this sorted. And to be fair, it is good, because I hear so many stories where if you have surgery, cut it out, it's finished. But I got advised the surgery is the best way. So after surgery, my recovery was unbelievable. It was fantastic. They had me up the next morning, walking around the ward. You know, I did a few laps of the ward, no problem whatsoever. I mean, you are out of puff and everything else, but you do recover, you know, quite quickly, and you sit. But the thing is just don't sit there and don't do anything. You must make the effort and just walk and walk and walk. And it just gets easier and easier.
The technology have dramatically changed over the last 25 years in surgery, and the advancement of the technology have changed our technique, allowing a keyhole approach in patients that we wouldn't have been able to offer a keyhole approach in the past. So nowadays we can deliver major surgery through keyhole thanks to the advancement of some of the technology and devices that we use in thoracic surgery. Over the years, we moved from an open approach to a multi-port approach to a uniport approach, and the thin shafts of some instruments allow us to insert all of the instruments in one wound. There are some slight technical differences from a traditional approach, but the operation inside is what matters and will be the same. Of course, for the patients, to have only one wound is a less risk of infection, is less pain after surgery, and therefore early return to work and be fit for additional treatment whenever required.
Yeah, I used to smoke like at school. You know, I was at that era where it was cool to smoke, peer pressure and everything else. The worst thing you can do is smoke. But I also work in a timber manufacturing, you know, so obviously we're cutting MDF, sawn timber, tunnelized timber, and a lot of times you go into the workshop and you're cutting, you don't put your mask on, and you think, I'm indestructible, you'll be all right. But yeah, put your mask on.
Diagnosis of lung cancer is overwhelming, and the patients who attend our clinic are distressed by the recent news. So it's very, very important to react to that news, following the advices, the support of the healthcare, and follow the plan for the treatment. The drive that a patient has to face the treatment and then recover is the key to have a good outcome and go home after lung surgery in 1 or 2 days.
So after my operation and everything else, it's the best I've felt in years, to be fair. It's a weird feeling because I've been so down for a long time. So a bit emotional, but anyway. And coming out of it and thinking, oh God, you know, this is fantastic. And I want to do things more. It's like, I'm so lucky. I love my sport and everything else. The best advice I can give anyone is don't let it get into your mind, you know. Think positive constantly, you know, and you'll be fine. That's, you know, that's my biggest advice, you know, and always go to your appointments. Definitely.